People who are trying to conceive, it is better to have a good lifestyle, including diet and exercise, and maintain an ideal weight and BMI. So we would like the patients to have a BMI of between 19 to 30. That is the ideal. Say, if you want to remember it easily, 20 to 30, that is a good BMI. And so BMI, as you know, is calculated based on the height as well as the weight. That's important. And people find it difficult to conceive otherwise. And also there are issues and complications if the BMI is lower or higher. IVF clinics do have restrictions regarding the weight and the BMI. For example, in the NHS hospitals, they don't offer treatment to any woman whose BMI is more than 30. That is the NHS cutoff. So anybody with a BMI of over 30, they ask them to lose weight and then come and see them for starting the IVF treatment, because this gives the best success rate. As we all know, if the BMI increases, the success rate goes down. That is why they want to optimize the success rate by reducing the weight. Whereas in private clinics all over the UK, they offer treatment to women till as long as the BMI is under 35. So they go a little more, and they always give you the advice to lose weight as much as possible. But sometimes we know that it's very difficult. And in some cases, the time is of the essence. We can't wait for 6 months or 1 year, then they will lose their eggs. Therefore, we do in private clinics, we offer treatment up to a BMI of 35. And in many clinics, there is also a higher cutoff. We offer treatment for heavier people, even if the BMI is over 35. Then what happens is we arrange for them to have a checkup with anesthetist, because if they are going to have egg collection, they will have extra risks, and therefore we would like them to have a discussion with the anesthetist regarding the risks during the procedure because of this, and risks of the anesthesia to the patient. We also arrange for them to have a discussion with the obstetric consultant who is attached to our clinic, so that they understand the risks of this overweight or obesity during pregnancy. It complicates the pregnancy for the mother as well as the baby. They can have complications such as high blood pressure leading to preeclampsia and gestational diabetes, bleeding, and other complications. Similarly, they can also have complications for the baby. There is an increased risk of miscarriage and preterm labor, and the baby's growth may be affected, such as intrauterine growth retardation, and sometimes they can have preterm baby. Any complication can happen. Therefore, it's better to reduce the weight so that someone can have a healthy pregnancy and also a healthy baby at the end of the pregnancy. That's why we advise them to lose it. But if they are overweight, we have had patients over the BMI of 35, but we have assessed them and make them understand all the risks, and then it's a multi-team management. Therefore, everybody takes care of their issues and they are looked after carefully. Therefore, we don't put their health to extra risk, and we look after them well. So we have had some patients, few patients, and who have been sort of heavier, but they managed to get pregnant and have babies with us. In fact, I know of a lady who had one baby, and then she came back recently for a second baby, and she got pregnant in the first attempt. She herself was surprised. She said, "Doctor, you made it so easy. I don't know what people are talking about." But it doesn't happen in everybody. It can happen in some people. So it can happen. It gives us hope. But at the same time, people should be aware of the risks and complications associated with the overweight and being obese. The message here is that it's not doom and gloom for people who are fat and overweight, because when they go to the NHS, they they have a bias against the fat women, and they don't provide treatment. This makes the women feel very uncomfortable and unhappy, get stressed and frustrated. It's not NHS fault, it is the lack of resources. That's why they are doing it. But at the same time, it causes depression in so many women who are already fat and they don't know what to do. But I want to say that the treatment options are available in clinics, so you can make use of it. But at the same time, women should be aware of the extra risks and complications due to this. Even in IVF treatment, the chances of success is lower in overweight women, and the embryos can be sort of fragmented. It is known that quality is not so good as women who are within the normal BMI range, and these things can affect the treatment as well as pregnancy. As long as people are aware, I want to say yes, they can have treatment, and we have made babies for such women.